What you need to know about heart disease. 1 in every 20 American adults are living with it. But the question is, could you have it right now and not even know about it? ABC News Chief Medical Correspondent Dr. Narula is here to break it all down for us and tell us about the test that we should be taking. First, you're a cardiologist.
I am.
So who's most at risk?
Everybody, right? So this is the leading cause of death for men and women. We don't think about it often, but it kills all of us more than all forms of cancer combined. So really important to pay attention. So when we think about risk factors for heart disease, I tell my patients there's only 2 you can control: age and family history. Everything else is in your hands. 80% is preventable. So when we think about risk factors for men, risk goes up over the age of 45. Women over the age of 55 are postmenopausal. And then we think about things like high blood pressure, high cholesterol, diabetes, smoking, alcohol consumption, whether you're overweight or obese, stress, mental health, sleep. These are kind of like everything that we look at when we figure out what you might be.
It's a long list there. Yes.
What might be your risk factors, correct?
Very long list. And what if you're not most at risk? What if you're in that average category? Should you get tested? How do you push for that?
Right. So we in cardiology almost feel like everyone should see a cardiologist at some point. And there are tools that we can use to help uncover whether you might be at higher risk. One of them is a risk calculator. You can actually go online, your doctor can plug in a bunch of your numbers and your age and gender and get a risk score. So they can tell you you are at a 10% risk of heart attack or stroke in the next 10 years or a 20% risk. Another test that I love is something called a calcium score. This is a very quick CAT scan of the heart looking for spots of calcified plaque. And then you get a score. 0 is the best score. We don't see anything. Anything above 100 is high and puts you kind of at high risk. And really, it's low radiation, like a chest x-ray, no contrast dye. It costs about $100, but that's a really great test for people to think about.
Okay.
And then you might get a general EKG in your doctor's office and lab work and obviously vital signs that can help us.
So what about symptoms here? What should we look out for, and when do we go see a doctor?
So anytime you feel anything here, right, it's very hard to tease out. Is it your heart? Is it your stomach? Is it your lungs? So I always say always rule out the heart first. So any chest pain, pressure, tightness, squeezing, burning in the chest, sometimes jaw or shoulder pain, shortness of breath, fainting, passing out, swollen legs, heart palpitations, and sometimes it can be as subtle as I just can't exercise as much as I used to be able to, or I'm exhausted all the time and I don't know why. But definitely the chest pain and shortness of breath, and it doesn't have to be pain, it can be tightness or squeezing sensation.
The doc is on it. All right, Doc, thank you very much. We appreciate it.
Thank you.